Chest physiotherapy, or simply CPT, is a technique that can be performed by certain healthcare workers for people suffering from diseases that impair mucus clearance, such as chronic obstructive pulmonary disease, bronchitis, and cystic fibrosis. The goal of chest physiotherapy is to help the client clear excessive mucus secretions from the lungs in order to prevent complications like mucus plugs, infections, and atelectasis. Before performing this procedure, be sure this is within your scope of practice and is allowed by your facility's policy. To start, first gather the supplies you'll need, including gloves, face shield, and gown for you, and pillows for the client's comfort. In addition, keep suction machine equipment available to assist in clearing airway secretions in case the client's ability to cough and clear their airway is ineffective. Make sure you know if the client is feeling weak, anxious, or in pain. Chest physiotherapy must be scheduled according to the client's needs and daily routine and activities. Individuals in pain can take analgesics 20 minutes before beginning chest physiotherapy. Each CPT session usually lasts between 20 and 40 minutes, which can be very exhausting, so try to schedule it between rest periods. Avoid performing chest physiotherapy around 1 to 2 hours before and after meals. The best times to perform CPT are in the morning to clear secretions that may have accumulated overnight, as well as at night to clear the lungs before bedtime. Frequency of chest physiotherapy varies for each client from just once a day to as frequent as every 2 hours. This will depend on each client's needs and capabilities, as well as the healthcare professional's orders, so make sure to check the nurse charts. Now, CPT includes postural drainage, percussion, vibration, and shaking. It involves a lot of touching, so before you begin, make sure you always explain to the client where and how you'll be touching. Postural drainage involves placing the individual in different positions for 10 to 15 minutes, using gravity to help clear lung secretions. Each position drains a corresponding lung section into the trachea, so before starting, you should know which lung segments require postural drainage to ensure the therapy is appropriate to the client's needs. Each position in postural drainage is followed by percussion over the lung area to be drained. To perform percussion, clap on the client's chest wall with your hands cupped for 2 to 5 minutes to help clear the mucus from the bronchi into the larger airways. Most movement should come from the elbows and wrists. Vibration can be applied by placing both hands over the same percussed area, one over the other, and performing a fine shaking movement for about 15 seconds or 5 exhalations. Finally, tell the client to cough forcefully to eliminate the lung secretions. Perform a total of 3 to 4 CPT sets and make sure there's suction machine equipment available to assist the client if needed. Alright then, let's start with the left and right upper lobes. To drain the anterior apical bronchi, position the client leaning back in a chair or in high Fowlers. Next, stand in front of the client and place your hands at the shoulders and your fingers over the clavicles. Percuss and vibrate with the heels of the hands on the client's chest. Make sure you do both sides at the same time. To drain the posterior apical bronchi, position the client in a chair, only this time leaning forward on a pillow. Then, place your hands on the upper back to percuss and vibrate both sides at the same time. Remember to never percuss directly over the spine. To drain the anterior part of the upper lobes, position the client lying back flat with a small pillow under the knees. To percuss and vibrate, place your hands just below the clavicles. Remember to never percuss directly over the sternum. To drain the lingula, which is a projection in the lower part of the left upper lobe, position the client lying on the right side with the arm overhead and put the bed in Trendelenburg position with the foot of the bed raised 30 centimeters or 12 inches. Then place a pillow behind the client to roll a bit onto it. Then place your hands lateral to the left nipple just below the armpit to percuss and vibrate. Now, to drain the right middle lobe, follow these same steps, but position the client to the left side. Finally, there's the lower lobes. To drain the superior bronchi of the right and left lower lobes, position the client lying flat on their stomach with a pillow underneath. Place your hands below the scapula on both sides to percuss and vibrate. To drain the anterior bronchi of the left and right lower lobes, position the client lying back with the knees bent over a pillow. Put the bed in Trendelenburg position, raised 45 to 50 centimeters or 18 to 20 inches. To percuss and vibrate, place your hands over the lower anterior ribs on both sides. Finally, to drain the lateral bronchi of the left lower lobe, position the client on the right side with a pillow behind the back and the right arm raised. Put the bed in Trendelenburg position with the foot of the bed raised 45 to 50 centimeters or 18 to 20 inches. To percuss and vibrate, place your hands on the left side of the chest, below the scapula and posterior to the midaxillary line. To drain the lateral bronchi of the right lower lobe, follow the same steps but on the opposite sides. There are a few things that must be documented after performing chest physiotherapy. Remember to immediately report to the nurse if you notice any changes in breathing pattern, as well as the client's comfort level and tolerance to the procedure. Observe the sputum and show a sample to the nurse to check the amount and character of sputum. Finally, the nurse should auscultate the lung fields to check if mucus clearance relieves abnormal lung sounds, like inspiratory crackles, to determine if the client is able to clear the mucus properly. Some individuals may experience fatigue or shortness of breath due to CPT. These individuals could benefit from using an a cappella device, which is a handheld respiratory device that clients can use independently. The device aids in mucus clearance and prevents airway collapse by combining positive expiratory pressure, or simply PEP therapy, with airway vibrations. The device is made up of a mouthpiece, cover, valve, rocker assembly, and a frequency adjustment dial to manage the flow resistance. Initially, it should be set to the lowest resistance. Over time, as the client improves, the resistance level can be adjusted upward by turning the adjustment dial clockwise. If the client needs aerosol therapy, a nebulizer can be attached to the end of the valve. To use an a cappella device, the client should sit up comfortably, inhale, taking a deep breath but not reaching maximum inspiratory capacity, and place the mouthpiece into the mouth while holding breath for about 3 seconds. Then, the client should exhale through the mouthpiece for about 4 seconds, transmitting the pressure from the airways to the device and creating positive expiratory pressure. As the pressure increases, the expiring air forces cause the rocker to vibrate. Repeat these steps for 5 to 10 breaths. If the client can't exhale for this length of time, the dial can be adjusted accordingly. Finally, the client can remove the mouthpiece and do 1 to 2 huff coughs to clear mucus. Alright, as a quick recap, chest physiotherapy, or CPT, is a technique performed by certain healthcare workers to help people with impaired mucus clearance. Chest physiotherapy includes postural drainage, percussion, vibration, and shaking. Postural drainage uses gravity to help clear lung secretions by placing the individual in different positions. Each position is followed by percussion, vibration, and shaking over the chest wall to help mobilize the secretions. Finally, the client has to cough forcefully to eliminate the secretions. Some individuals can also use an a cappella device independently. The device